Namaste, COVID warriors. I would like to address you as COVID warriors because you all belong to Rajiv Gandhi University of Health Sciences. You are all part of this large family and you have volunteered to be rendering your services for the crisis that has cropped up now. We are now amidst the COVID pandemic, and about 10 or 12 days ago, I requested all of you to enroll as volunteers for various activities that you may be required to render. And I'm really thankful that more than 35,000 of the students, both undergraduates and postgraduates, and some alumni also have enrolled themselves as volunteers. My request is the more the merrier. I would request you to enroll one more so that the number doubles. And why do we require so many volunteers? This is a pandemic, a new pandemic. All of us are not aware of the course that this pandemic would go through. We are in the, expecting a surge to happen, so that large amount of activities have to be envisaged. Volunteers can come forward to play a important role in containment of this disease, and you have so many activities that you can render your service as undergraduate students, as postgraduates, as interns, and also as residents. One of the ways is, first of all, I would request all of you to gain a complete knowledge, up-to-date knowledge about COVID, how it presents, its epidemiology, its manifestations, and also the management of cases. When you are well equipped and also confident about the disease, you can give good health education to others, and that's the most important need of the day. So, I would request you to render yourself to this activity of health educating many of your friends, your family, and maybe your colleagues as well. So this is one activity which you can do without any much disturbance to your routine activities. Wherever you are, you could go on doing this activity. Secondly, Government of Karnataka would require your services in certain other activities. Like, for example, we are running an helpline wherein this, again, same health education activities, or rather doubts, the anxiety, the many questions that the general public have can also be answered to on a day-to-day basis, and this is being addressed by 104 helpline. You could volunteer yourself to allot certain fixed hours in your busy schedule, and you can render your services and then take these calls and answer these calls and try to give authentic information to all the general public. Many of the times you must have noticed that information and authentic information is very important in such situations. We should not believe the fake messages that keep coming to us through various social media and other sources. This is very important. So, general public who are actually not well aware of the health hazards of COVID-19 will be much more in an anxious state, much more in a doubtful state. So, it's our bounden duty that we give them authentic information. This is one important role that you can play. Secondly, you could also play a role in screening of patients, helping the volunteers, other volunteers like the doctors, senior doctors, and retired doctors who have volunteered themselves to join this force to screen the patients, identify patients with COVID symptoms. You are well aware that COVID symptoms are fever, cough, then myalgia, headache, and breathlessness. These are the most important symptoms that patients would present with, generally called as ILI, influenza-like symptoms. So, if you see these or recognize these symptoms in a patient, you could help them to see that they reach out to a facility, especially a fever clinic or a COVID care center, where they would be taken care of by the system. This is one important thing that you can do. You can also help the patients in quarantining and also isolation, giving them correct information about various quarantine facilities, about isolation facilities that the government has set up. This is another important thing. You could also help in taking care of large migrant population. You see in Bangalore BBMP area itself, I am told there are more than 400 sites where all these migrant workers are housed. it is imperative that we take care of them also, not only providing them livelihood, but also taking care of their health. There may be a lot of elderly people, there may be quite a few pregnant women, there may be children below the age of 5 years, so they need to be fed and their health also has to be taken care of. So if you volunteer, camps can be arranged for them, and you could take care of their health as well and identify their problems, health problems, and refer to appropriate centers. This is another major activity that needs to be done today, and as volunteers, I'm sure all of you can take care of this problem. Apart from that, many of you are very well tech savvy also. You could render your service in compilation of data, data analysis, and maintaining data of all the patients, COVID patients, or maybe patients who are quarantined, patients who are isolated, convalescent patients. All these things can be done. And beyond that also, analysis of data, and which will help us in understanding the disease much better, and also equip us with much better armamentarium to face this disease if at all it reappears. So you could render your service as a tech-savvy volunteer. That's one more thing. Finally, Government of Karnataka has also established a very unique facility called as Tele-ICU. This Tele-ICU facility is housed in the Health Commissioner's office in Andhra Circle, wherein already some of you have volunteered to come forward and then be housed there in a 3-hour shift duty of 8 hours each, where you will be volunteering to collect the data of moderate to severe patients and also patients who are in ICU, and having a one-to-one contact with all the peripheral districts. Wherever there are patients who are admitted to with moderate severe cases and also acute cases directly landing up in ICU, these cases are monitored. The case sheets are all mirror images of case sheets are maintained in this Tele-ICU facility, and you could interact with the doctors who are actually treating the patients, and if they have any doubts or any other clarification that is required, we have a set of specialists, both pulmonologists, anesthesiologists, general physicians, and all other specialists who are well versed in managing these cases. They will be offering their valuable consultations, valuable opinions, and will also help them to see that how these cases can be better managed. So you could play a important link between the doctors who are in the periphery, maybe in Bidar, maybe in Gulbarga, maybe in Bagalkot, and doctors who are in Bangalore who can guide them. So this is only to ensure that we will not have any mortality in our state anymore. We already have lost around 13 patients out of the 300 patients that we have found positive. And though on a national scenario we are doing well, but still every life is important. We need to protect every life. And in this war that we are all facing, the enemy is not visible right now in front of us, but we know the characters of the enemy. We have studied the enemy quite well, and I wish all of you take up this volunteer work and be in the front line working as warriors. That's the way soldiers face any war. You are also warriors. That's the reason I have called you as COVID warriors. Please do join us, and together we can. Together all of us can overcome this pandemic. I also appeal to all of you as volunteers to download Aarogya Setu app, which is the app provided by Government of India. It's a very useful app. So far, more than 13 crore individuals have downloaded this app. It will give you a lot of information of COVID activity that is going on in the country, state-wise, then district-wise details. Then also, it will also alert you whenever you come across or you are very close to a contact, primary contact or a secondary contact, or even for a COVID positive case for that matter. That is one thing. And Aarogya Setu app will also provide you a lot of information regarding this disease, which you can download and use it as a material for health education as well. Thank you so much. I appeal to you, each one enroll one. Thank you so much.